Hi everyone, today's going to be a short video about some things you can do if you have type 2 diabetes or if you're pre-diabetic and you know that type 2 diabetes is coming if you don't intervene. The really good news is type 2 diabetes is modifiable. This is something that is brought on by lifestyle and can be reversed with lifestyle. And I will tell you that sometimes the steps, the action steps you have to take to reverse it can be a bit of a challenge. You're going to really overhaul in many cases the whole way that you view food and living. You're going to have to really make some trades in order to be healthy. But the good news is almost everybody, once all the dust settles and they've really got a nice healthy lifestyle and any excess fat has come off and muscles come on, etc. Once those blood sugar levels are normal again, no matter how many sacrifices you made to get there, you feel fantastic. In 30 years of coaching, I've never seen anybody say, yeah, I'm healthy now, but I really miss all the junk food and I miss not exercising. I've never actually heard that. So anyway, let's go ahead and dive into it. Okay, this will be a fairly short video, just touching on a few key points, and then I'll come back in the near future and do some more videos on diabetes, type 2 diabetes specifically. But there's some important things you got to know. Okay, now the main word you want to really attach to your vernacular here when it comes to preventing or correcting type 2 diabetes or pre-diabetes is undermuscled. The word undermuscled, because we've talked a whole lot in the past about being over fat, about having adipose, having excess body fat on the body, and how harmful that is for you. However, science is finding more and more and more that it's not so much the excess fat, it's the ratio of fat on your body to muscle. And that ultimately, just by gaining muscle, that's actually more productive than losing fat, if you can imagine. So in a nice way, you can actually keep some of the fat on. You don't necessarily have to go through all the trials and tribulations and struggles involved in burning off body fat, although I'm still going to suggest that you do. But even if you don't, statistically speaking, what we're finding is just by packing some muscle on you, and I don't mean big bulky muscle that's all that noticeable. I just mean muscle so that you're more fit, you're more strong. If we just do that, you're generally going to be a whole lot more likely to manage blood sugars. And I'm going to give you a little example as to why, okay? Think of it this way. When you're consuming carbohydrates, those carbs or sugars, glycogen, glucose, get stored in your muscles, right? It gets stored elsewhere too, but a lot of it gets stored in your muscles. And it's like you're programming the muscles by putting the carbs in there. It's like you're telling the muscles, hey, I'm going to put you to work soon. I'm going to have you go through full range of motion work. It's going to be vigorous. It's going to be for long term. And your muscles say, okay, I'm on board. I've got the sugars in me now. Let's do this. And then you don't really give them that. Maybe you get a little 20-minute workout or something that's not clinically appropriate for really utilizing the blood sugars that you have in you, right? Based on the carbs that you consumed. And so what ends up happening to people is you get all this blood sugar, you got the sugar, stored up in your muscles. And now the muscles don't know what to do with it because it just keeps storing up inside the muscles. And there comes a point where it has to get pushed back out into the bloodstream. And so now some of that sugar, since it's not getting used in the muscles, it goes out into the bloodstream. And if that goes on for a day or two, you're probably going to be fine. The body can adapt. But when this becomes your lifestyle, that you're consuming so many carbs that they're not really adding up to what's going out in terms of cardiovascular, strength work, challenging exercise for the muscles in the body, well, then what ends up happening is you end up with blood sugar disorder. You end up with too high of blood sugars. You go pre-diabetic. And then if left untreated, this becomes type 2 diabetes. So I'm boiling it down a little bit simply. There's a little bit more to it than this, but this is a fair way to look at it, is that this is the way you want to be thinking is, wow, if my carbohydrate intake is not appropriate to my exertion and to the kind of muscular work that I'm putting out, then that's what I'm potentially going to end up with. And so one of the ways to fix that is to become more muscular, to put on more muscle on your body. And I want to put it in perspective, okay? For most people, just gaining 5 or 10 pounds of muscle will absolutely improve your blood sugar levels a lot. So it doesn't take a lot, 5, 10 pounds, for a lot of people, even less than that. Now, let's put this in perspective. You might be thinking, well, how long does that take, though? Does that take years? No, you can usually, as a beginner, gain about a pound of muscle. If you're pretty detrained, you can gain about a pound of muscle a week in those initial weeks. And then that usually tapers off to more like half a pound or a quarter pound or so per week after that. And of course, depends upon how scientific your training is, right? We've got to get the right modalities, the right intensities, and the right durations. So you really want to make sure that you're getting a top personal trainer or a corrective exercise specialist or someone who really understands how to do this, because regular exercise in and of itself isn't going to do it. You do need to get the right intensities, etc. But if we follow the guidelines and do it right, you can probably gain about enough muscle to start really mitigating the blood sugars in maybe a few short weeks, 2, 3, 4 months tops. That is generally enough time to make this happen for you. And so please, if you find yourself in pre-diabetes or type 2 diabetes, and you're saying to yourself, oh my gosh, you're imagining a bad future for yourself, know that you can turn this around quickly. It's a time investment. It's a discipline investment. You're going to have to change your lifestyle. What's going into your mouth is probably going to have to change as well, or at least the quantities of it. And you're probably going to have to hire a coach because, again, most fitness programs don't really do a whole lot to reverse this very well. Some do, but in general, everyone's different. You really want someone who really understands your body well. But you do not have to see this as a long-term problem. You can turn this around. And while you're turning it around, the really nice news is you're also going to reduce risk factors for other problems, for similar comorbidities and things that can happen. So, the right answer is if your blood sugars are even a little bit high, let's fix them. If they're not yet high, then let's make sure you don't let them get high. Let's make sure we put you on the right kind of program, nutrition, lifestyle, and exercise science, so that you make sure that you're maintaining your body day to day. And when you put your head down on the pillow at night, you can feel good about the day you just accomplished, the day that's ahead of you, and your health moving forward. So guys, my name is Val Fiott. I've been a coach for a long, long time now, over 30 years. I've worked in pretty much every aspect of fitness and health science that I can imagine. And you can go ahead and reach out to me anytime. I am available for Zoom sessions. Comment down below. You can call me. My phone number is down below as well. Just get in touch and you can either work with me or I'll set you up with another great coach who'll be a good fit for you. I'm looking forward to your health and your fitness success.